Hi, a lot of patients ask about when am I going to feel better? So when you get in an accident, any type of injury that occurs in your body, it goes through the three phases of healing. So I'd like to talk with you today about what happens in the three phases of healing. The first phase of healing is the inflammation phase. And during that phase, your body swells up. It's very, very painful and sore for about 3 days. Then after that 3 days is over, the swelling goes down a little bit. You feel a little bit better, but it still hurts, and you're in the second phase of healing then. It's called the repair phase of healing. In the repair phase of healing, that's when your body is making a special protein called collagen. Collagen is also known as scar tissue, and if you look at it under an electron microscope, you have many fibers going in every different direction. If you were to throw a mop on the floor and take a look at that, that's kind of what it looks like, just strands going in all these random directions. What the scar tissue does is it tries to grab onto anything it can in the area, and over time it thickens up, it gets stronger, and then it shrinks and pulls everything together in an effort to try to stabilize an unstable area. Sounds like a good idea for the body to do that, but at the same time, if it does thicken up and get stronger and trap pain fibers in the process, then these scar tissues, if they're pulled by you moving your body in a certain way, the scar tissues will pull on those pain fibers and cause pain for no reason at all. So the chiropractic adjustment and also the exercises that we show people how to do, those help to reduce the trapping of those nerves in that scar tissue. The third phase of healing is the remodel phase of healing. So the first phase is the inflammation. It lasts for about 3 days. The repair phase lasts for about 3 months when your body's making that scar tissue. And the third phase, the remodel phase, it could last up to 9 more months. And you are going to feel a whole lot better after the second phase of healing is done, but you may not feel 100% normal just yet. So the last thing I wanted to share with you is that there's 4 negative aspects of the repair phase of healing. So the nerves that get caught in that scar tissue, they also become very sensitive. And so we employ the right therapy to help decrease the amount of sensitivity that a person feels in the injured areas. It's called muscle stim. It's a couple pads that stick on the area of the skin right around where the pain hurts the most. And the machine that we have sends a small electric current through that area to desensitize the amount of pain that you're feeling. It helps it feel much better. So the other thing that happens with the nerves is that they do get tangled in that scar tissue. So let me leave things at that. There's some more videos that I would like to go over with you. Once again, I'm Dr. John, and we'll talk about those other things in other videos. Okay, thank you.